Hey yo! Do you know what is phenylketonuria? Let us explain what is phenylketonuria.
Actually, phenylketonuria is a rare inherited disorder that is caused by error of metabolism of a protein called phenylalanine that can cause intellectual, physical, and mental defect. What is the mechanism behind phenylketonuria? Phenylketonuria is caused by a gene defect that causes insufficient production of an enzyme called phenylalanine hydroxylase, PAH. PAH functions in the body to convert phenylalanine to another protein called tyrosine. This causes phenylalanine concentration in the body to increase. Meanwhile, tyrosine concentration is decreased. This creates an accumulation of phenylalanine. The accumulation of phenylalanine and reduction of tyrosine will affect in severe brain disorder, abnormal brain development, and intellectual disabilities.
So, what are the factors, or causes of phenylketonuria? Phenylketonuria is because of defect on genes, which called as PAH gene, on chromosome 12, that makes it lack of an enzyme, which is phenylalanine hydroxylase, that hydrolyzes the phenylalanine to tyrosine. Phenylketonuria also causes by consumption of protein and aspartame that has a high content of phenylalanine. Actually, this rare disease once happened to a Malaysian boy a few decades ago. Let me tell you the story. Once upon a time, on January 1988, a 6-year-old boy was rushed by his parents to Hospital University Sang Malaysia, HUSM. The doctor held some checkup on him and he was early diagnosed with the problem of aggressive behavior and developmental delay. At first, they don't even know that the boy actually had phenylketonuria disease. According to his mother, he was born in Mecca, Saudi Arabia after an unexpected pregnancy. When he was 3 months, she noticed that he was rather quiet and cannot hold his head up. He rolled over at 6 months, sat without support at 20 months, walked at 2 years, and talked with meaning at 3 years old. His normal black hair also gradually changed to light brown as early as 1 year old. But oddly there was no history of light hair on both parental sides. According to the clinical examination, the child has a stunted height with weight below 3rd centile, light brown hair, very playful and hyperactive, destructive and aggressive towards the other children, and could not follow simple instructions, read and solve simple arithmetic. Apart from mental retardation, gross motor development, neurological and rest physical examination, everything was normal. After a few investigations and tests on March 1988, it was revealed that the boy's urine has high concentration of phenylalanine. Thus they begin a low phenylalanine diet on the boy with the help of dietitian and health workers. It may improve behavior but cannot reduce the mental retardation. Unfortunately, 6 months' effort went in vain as the boy cannot cooperate and the parents cannot afford the cost of the diet. Special diet then abandoned, but the psychologist worked together with the health workers to help to focus only on the boy's social rehabilitation and genetic counseling. Hi there. Next, let's find out about the symptoms of phenylketonuria. The symptoms of phenylketonuria are skin rashes, which is also known as X-Men X. The symptoms are microcephaly, which is a condition where the patient will have an abnormally small head. Not to forget, hyperactivity and fair skin with light color of eyes and hair is the symptoms. More, phenylketonuria patients are keen to have a musty smell in their breath, skin and urine, and also they will experience intellectual disabilities, psychiatric disorders and delayed development compared to the other kids with the same age. They would also develop some behavioral, emotion and social problems in their daily life. Microcephaly is also known as abnormal size of head. This is a condition where phenylketonuria patient might have a small head which is abnormal compared to the normal and appropriate size. Next, this is the example of skin rashes condition where their skin will be dry, itchy and reddish. Further scratching might lead to wounds and scars. Moving on, next is the mental retardation in patients with phenylketonuria, where they will have a below average intelligence and slow learning ability. This condition happens when there are too much phenylalanine in the body that leads to brain damage. Now let's talk about appropriate intervention or treatment. There is no cure for PKU, but there are some treatments that can prevent the intellectual disabilities and other health problems. Firstly, people with phenylketonuria should take a low diet of phenylalanine in their foods. They need to avoid various high-protein foods such as nuts, meats, eggs, milk, and cheese. Next, avoid the artificial sweetener aspartame in some foods, drinks or vitamins, because aspartame will release phenylalanine when it is digested, and it raises the level of phenylalanine in a person's blood. Other than that, for babies with phenylketonuria, they should drink a special formula that mixed with small amount of breast milk or regular infant formula to make sure the child get enough phenylalanine for normal development. Phenylketonuria also can be prevented by pharmaceutical treatment. Fifthly, is by taking Kuvan, a prescription medicine that used together with low phenylalanine diet. Kuvan can improve phenylalanine tolerance and increase phenylalanine hydroxylase enzyme activity. Next is Palynziq. Palynziq is a prescription medication that is recommended for the adults with phenylketonuria to lower blood levels of phenylalanine. However, by injecting Palynziq, it is also can cause several side effects to a person.